name is Janae Gerard, and I'm the author of Off the Rack, and I'm also the creator of Beyond the Booby Trap. And today I'm here with Sherry Williams, who's with Angel Hand Massage. And we're very lucky to have her because we're always trying to learn ways to move forward. And I just want to caution you that if you have any problems with lymphedema, or you're just coming out of surgeries, or you might still be, in treatment, always consult with your medical professional before you try to go out and do anything. And so, just a caution for you. But thanks so much for being here. I really appreciate it.
Oh, thank you for having me, Janae. I'm excited to visit with you.
Great. So what does a patient look for? They're coming out of all of this stress, all of this treatment. They're struggling to try to find a new normal. And so I know that massage can be a great way to try to move forward and feel better. What is a patient coming out of this breast cancer treatment? What would they look for, qualities, and what type of personality, or can you shed any light on what you think might be a good match for a patient coming out of that?
I think that it's really important to have someone that's very knowledgeable about trauma, someone that understands how trauma gets in the body, what it does to the body, because this is a very traumatic thing that's going on with cancer and the treatment especially. Someone who's got a lot of strength and that's not going to be afraid of what you're going through, that's going to be able to be supportive and empathic, someone that can have a sense of humor. I think that's really important also. It's real important to find someone that has experienced, dealing with clients that have had the surgeries and the treatments and things like that. So it's real important for that knowledge, I think.
Let me ask you this, as far as what someone could hope to benefit from actually going to a massage therapist, what might we expect as far as results, and how might it help as far as stress reduction, etc., just from the body?
Well, it's awesome for stress reduction, of course, because it brings a sense of relaxation, but it brings a sense of being able to be in your body and to be able to love your body again, to have someone touch you in a nurturing way where you're contained in a space that feels safe and non-judgmental, a place where you're being held. And it's important because it creates a lot more circulation, which brings more oxygen to your muscles and blood, which allows you to detox everything that you've been dealing with. It helps you be more focused and yet at the same time allows your mind to just drift while you're being worked with. And there's a lot of different types of massage.
What would you tell a patient, a breast cancer patient that has scarring and may not feel that great about themselves and might be afraid to go to a massage therapist because of what they look like, or anything else going on with them? I mean, what would you tell a patient that's afraid or embarrassed by their scars?
That I don't look at the body on the outside, that I'm more looking at your body on the inside from your emotional standpoint and your energetic standpoint. And the scars aren't something that bothers me. It's not something that I'm focusing on, except for releasing any scar tissue that might come in. So it's real important also, that's a real important aspect of getting massages, to keep the scars and the tissue around it softened and manipulated so they don't get hard and start pulling. So it's not that I'm looking at a body. I get skinny bodies and heavy bodies and bony bodies and scarred bodies and traumatized bodies, and they're all a part. They're all body, mind, spirit together. So it's not looking at the outside of someone's body.
Gotcha. Well, I happen to have the latissimus flap surgery, which bears some problems that come along with it, right? The body and the back bear some stress just because of that surgery. I know that you worked on me, and it was great, and I know that you've worked on several people that have had this type of surgery. Can you talk a little bit about what you've experienced as a massage therapist with this surgery, with muscle problems, how muscles are compensating for the ones that are not in the back anymore, and how the body responds to that?
Yes. Your body is already usually going into a shoulder forward cupped space that protects your heart, and it's a lot of weight on your shoulders for the responsibility of what's going on with you. That that it's like almost like you said in your books. That, it's like the weight of the world is sitting right there on your shoulders. So when the muscles that hold your shoulder blades up against your back and hold your shoulders back and allow you to expand and open up, that's part of your latissimus dorsi. And when that's taken and pulled from your back into the front, that also pulls forward. And that's a large muscle. And when that large muscle that holds you up and allows your shoulders to move and allows you to pick things up and to pull things down and to reach out like this and pull in, when that muscle is no longer where it belongs, where it works the best, but it's brought forward, then it's left all these little muscles in the back to do all the work of the big muscle. So you have 3 erectus spinatus, which run all the way up from your spine, all the way on both sides, 3 on each side, and those start really working hard to hold you up and to allow you to come back. I think it's really important to remember to stretch your pec muscles back, because these get shortened and the back muscles in the back get elongated, so the traps get elongated. And so if you roll back and keep those worked back, and then get massage to release the tension that's in these muscles, because it's going to take a while to learn how to reset your structure. Because the muscles are what holds our structure in place, and if that muscle that's really used to holding everything down and in is not there, you're going to find your shoulder blades may wing out, and when they do, then your shoulders come forward. That can cause impingement in frozen shoulders and more short back. It's really important to have the relaxation, and have sometimes you might need some deep tissue. My suggestion too is that you can find a massage therapist that does trauma work with somatic experiencing that I do. It's really important to allow the emotional aspect of that to be cleared as well.
You said somatic
experience.
And can you describe that briefly?
Somatic experiencing is an organic trauma release where I go in and work with your body's energy and see what's stuck, because trauma gets stuck in the cellular memory, it gets stuck in your muscle memory, the emotions of what's going on get stuck in different places in your body, and when it gets put in different places and it stays there, then it starts causing chronic pain, chronic issues. And we've spoken before about how the pain starts to kind of creep up on you, and all of a sudden you realize that it's huge, it's there, and it's
cumulative.
Yeah, it is cumulative. Well, okay, so this stuck energy, this frozen energy, is also cumulative, and it can start from the moment you conceive in your cellular memory, and then when you go through something big like this, it brings all the other stuff up. So the somatic experiencing is a beautiful way, and it's very subtle, and yet it's very profound, to allow the energy that's stuck to be released, to work through the chemo, to work through the anesthesia, to work through the trauma of just realizing, oh my God, I'm dealing with cancer now. This is a life-threatening disease, and I'm really having to look at it, and learning how to work with that with humor. And your book, by the way, is awesome.
Thank you. So if, I was just kind of curious, I had a curious question, is do you see any personality traits or any similarities with a number of the breast cancer patients that you've worked on?
I'd say, unfortunately, I do see, a pattern of overachieving, so trying to prove yourself to someone else, trying to get approval from outside yourself. It's very subconscious. It's not a conscious thing at all. It's like, I'm doing really good. I'm really getting out there and I'm making a mark, and yet when some people make that mark, they're still not satisfied. They can't connect with the pride or the approval of themselves, and living their lives for someone else, choosing a profession or a spouse or a car or something like that to please their parents or someone else.
So what's interesting with that for me is that may be a barrier to seek help in massage therapy, because they're not thinking about themselves.
Yes.
So everybody that is an overachiever and trying to live life for someone else, make sure to take time for yourself.
Yes.
Make sure to seek out help, and massage therapy is a great way to do that. So again, Sherry, I really appreciate you being with us and talking to my group.